So, should medicinal cannabis, I've been practicing that, be more widely available for illnesses? Have you used it maybe? Has it helped? Well, last week it was Medical Cannabis Awareness Week, which raises awareness about the access and availability to safe and secure treatment for those with chronic health issues. It comes on the back of a new report that reveals nearly 1.8 million people with diagnosed medical conditions in the UK are turning to illegally obtained cannabis to manage their illnesses. Well, joining me this afternoon is Jon Robson. He's CEO of MAMEDICA and one of the UK's only medical cannabis clinics. Hello, Jon. How are you?
Hi there, Liz. Very well, thank you. How are you?
Yeah, good. Thank you for coming on. We've also got Dr David Howells joining us as well, and he is a consultant psychiatrist. Good afternoon, Dave.
Hello, Liz. Thank you for having us on.
Oh, thank you so much, both of you. So I'm going to ask, can you explain the difference between cannabis and CBD products, first of all? I don't know who wants to take that question.
Yes, of course. So CBD products are over-the-counter products that are available recreationally via high street shops such as Boots or Holland & Barrett. Medicinal cannabis contains THC, which is one of the other main components of the cannabis plant, and that is a controlled drug and is only able to be prescribed via a service like ours by a specialist doctor like Dave.
Oh, okay. Yeah, because I have to say, I have seen, in health food shops and various chemists, CBD oil. I've even seen hand cream with it. I've seen all sorts of things, cream with it in. And you kind of sort of think, oh, well, what's the benefits of that? How do those products work then, those over-the-counter type things?
The over-the-counter products contain CBD, which is a non-psychoactive element from the plant. Now, with regards to patients who suffer from debilitating conditions, it's actually the controlled psychoactive element, THC, which is required in combination with CBD to effectively interact with the body's endocannabinoid system, which is where the receptors are located and helps to regulate pain or sleep or appetite loss, as the case may be.
Oh, okay. So, Dave, how does medical cannabis work then?
Okay, well, every human, in fact, pretty much every animal, has a unique endocannabinoid system. It's an ancient system within the body that predates many of the systems that we already have. So it's interlinked in so many systems within the body that it's incredible that it's only really been found by researchers really in the last couple of decades. So we've got an entire formulary which we use called the BNF in medicine, which gives us all the different medications which we're able to use as doctors and prescribers in order to address complaints that the body has. Now, within that book, there's only 3 drugs which actually target the endocannabinoid system. And so those are very tightly restricted. And so we don't have very many options to actually address the deficiencies within the endocannabinoid system and to use it really to promote health. So it's kind of like trying to do medicine with one arm tied behind your back. And that's why this is such a fabulous and interesting area to be getting into, because the potential is almost limitless. There's a lifetime's worth of research to be done in this area.
Yeah, sounds like it. I mean, we were saying earlier that a lot of people are turning to illegally obtained cannabis to manage their illnesses. Mm-hmm. Is that because their doctor or the person that they go to, their GP, won't prescribe medical cannabis, or is it that they think they won't prescribe it?
Well, cannabis has been a Schedule 1 drug for many, many years. And so it's only 4 years ago that it's moved to a Schedule 2 drug, whereby it's accepted that there are medicinal uses for it. Now, cannabis is an incredibly complex product which has hundreds of different compounds in it. And it's very difficult for researchers, therefore, to do research involving a single compound. Because it's not recognised as having medicinal uses, cannabis interacts in such a complicated way with all these different elements that taking one element out and researching it doesn't quite give the same medicinal benefits that a whole product cannabis does. And because of that, we're very reluctant to prescribe those as doctors because they don't have the same safety and efficacy data as all the different drugs that we commonly prescribe. However, the research that has been done and the real-world experience is that it's a very safe medication if used under medical supervision with the right sort of safeguards in place, and the product, what you're getting, that it's not contaminated, that it's been jumped through the regulatory hurdles to make sure that it's what you're getting and it's under proper supervision.
Yeah. I mean, Jon, are you seeing a particular type of patient coming to your clinics then?
So I would say that pain patients make up most of our quota of who we have currently registered.
Right.
70% of the patients that we see are for pain, and the rest is made up of psychiatry, neurology, palliative care, and people that are suffering from cancer-related conditions as well.
Right. Gosh. I mean, I'm sort of sat here and I'm very fortunate that, I'm quite well. But there's part of me thinks, well, this is treating that pain, but it's not getting to the source of that pain. Does that make sense? So
sure.
It needs to kind of be a two-pronged attack.
Yeah, you're right. We don't cure any of the conditions that we treat. We are just providing relief through the medical cannabis.
Yeah.
So that patients who are suffering from, life-affecting, debilitating conditions are able to go out and do things that they wouldn't be able to do ordinarily if they were being prescribed traditional medicines like opioids.
Yes. I mean, I was reading there's, with a lot of pain medication, there are a lot of side effects, aren't there? I know from my own mum, she has a very long list of medications she's on and, there's all kinds of side effects. What are the kind of side effects that people see with medical cannabis, or is there not?
Well, if I can pick that one up.
Yes, please, Dave.
Medicinal cannabis, the common things people might experience are some sedation. We tend to recommend that people start at very low doses so that you have the minimum effective dose without getting those side effects. But people commonly report a dry mouth. They can get red eyes. There may be interactions with some other medications which need to be taken into consideration. Yeah. But these are things which actually people may look for as well. If you're wanting to get to sleep, some sedation is quite good. If you lack your appetite, then, having what would commonly be called the munchies is actually a good side effect as well. It can, in the acute phases, when people have taken this, they can find that their racing thoughts, their preoccupations, those negative ruminations are addressed by this medication as well. So the ability to forget the things that are going on in your daily life can be beneficial and can help people relax in a way that might be considered safer than, say, alcohol at the end of the day.
Oh, absolutely. Yeah. It's fascinating. It's really interesting. I mean, Jon, if anyone's listening and they're sort of thinking, gosh, I would like to speak to my healthcare professional, or I want to give them some information and get them thinking about whether this is something that can be involved in my care, where can people find out a bit more about this?
Well, look, NHS doctors prescribe to a very stringent set of guidelines. They follow NICE guidelines. So if you go and speak to an NHS doctor or a GP about this, you're very likely to get not a lot of information coming back, or none at all. Right. To be able to find more about medical cannabis, you would need to go and visit a website like MAMEDICA's to find out about the different conditions that we treat. And ultimately, it would be for a patient to have a consultation with a specialist doctor like Dave, to establish whether or not medical cannabis could be beneficial for their particular ailment. And it's not a one-size-fits-all, which is why patients need to have an initial expert evaluation and then follow-up consultations to make sure that the dosage is providing relief, as the case may or may not be, so that we can maybe adjust it. And ultimately, what we do is we create a bespoke treatment plan for each individual patient, and we adjust that where we see fit to ensure that the patient is getting some benefit from our service.
Yeah, I mean, it's fascinating. Is that something that I can do through the NHS then, or is that a private thing? Can I ask my doctor for a referral to you guys?
The NHS only provides access to medical cannabis for 3 conditions. There is adult and child severe cases of epilepsy, which probably you've heard about from a number of years ago, which actually was the catalyst for medical cannabis to be legalized or to be reclassified for medicinal purposes for adults, but ironically it's still very difficult for children to get access to it. Spasticity caused by MS and vomiting and nausea induced by cancer-related treatments. So the scope for access is very limited. And even if you do have one of those conditions, you'll find it very hard to actually get a prescription from the NHS.
Gosh, what a shame. That does make me sit here and think, yeah, it feels like more and more patients are having to take their care into their own hands and think, well, actually, do you know what? I'm going to have to pay for that because it's important and I need it, so I'm going to have to pay for it.
Yeah, I mean, as proved by the increase in private GP services that have become available, because a lot of people can't access GP services in a decent time frame. This is essentially the case, or we effectively are plugging a gap that the NHS is not providing.
Yeah. Well, Jon, thank you so much for coming on the show. That's Jon Robson, CEO of MAMEDICA. Dr Dave Howells is a consultant psychiatrist there. Thank you both so much for coming on and chatting about it. It's a fascinating subject. Thank you so much.
A pleasure.
Thank you, guys.